If you think leaving a little urine in your bladder is normal because you're getting older, you may be making a dangerous mistake. I'm Dr. William Lee, and today I'll explain why incomplete bladder emptying can quietly increase your risk of infections, bladder stones, sleep disruption, and even kidney damage if it continues for too long. The good news is that 3 scientifically supported techniques may help many people empty their bladder more completely, and the third one is often overlooked, even by patients who have struggled for years. Many adults over 60 notice they still feel like they need to urinate moments after leaving the bathroom. Some wake up several times every night, while others experience a weak stream or constant urgency. It may seem like a minor annoyance, but it can signal that your bladder isn't emptying efficiently. Stay with me, because one common bathroom habit could actually be making the problem worse without you realizing it. Your bladder is designed to work with an amazing communication system between your brain, spinal cord, bladder muscle, and pelvic floor muscles. As we age, these signals can become less coordinated. Conditions such as an enlarged prostate in men, weakened pelvic floor muscles in women, diabetes, certain medications, and nerve changes can all interfere with complete bladder emptying. Research published by respected urology organizations shows that persistent urine retention should never be ignored because it can increase the risk of urinary tract infections and other complications. The first scientifically supported step is surprisingly simple. Don't rush. After your urine stream stops, remain seated or standing comfortably for several seconds, relax your abdomen, take a slow breath, and allow your bladder another chance to contract naturally. This technique, often called double voiding when you wait briefly and try again, has been recommended by many urology specialists to help reduce leftover urine in selected patients. But there's another mistake that prevents this method from working for many people. The second step is to fully relax instead of pushing hard. Straining may seem helpful, but excessive pressure can actually interfere with the normal coordination between your bladder and pelvic floor muscles. Gentle breathing helps those muscles relax, allowing the bladder to empty more naturally. If you constantly force the urine out, you may be training your body to rely on the wrong muscles over time, and what happens next may surprise you. The third step involves your body position. Sitting with your feet supported, leaning slightly forward from the hips, and keeping your knees comfortably apart may improve bladder emptying for many people. This posture can reduce tension around the pelvic floor and make it easier for the bladder muscle to do its job. Small changes in posture may sound too simple to matter, but studies suggest body positioning can influence how effectively some people empty their bladder. If you're drinking less water because you're afraid of frequent bathroom trips, be careful. Concentrated urine can irritate the bladder lining and may increase discomfort. Staying appropriately hydrated during the day while limiting large amounts of fluids close to bedtime if recommended by your healthcare provider often supports healthier bladder function. However, if you suddenly cannot urinate, develop severe pain, notice blood in your urine, experience fever, or have repeated urinary tract infections, seek medical attention immediately because these symptoms require prompt evaluation. Remember, these techniques are not a cure for every cause of incomplete bladder emptying. An enlarged prostate, bladder prolapse, nerve disorders, medication side effects, or other medical conditions may require professional treatment. If your symptoms are persistent, worsening, or affecting your quality of life, don't assume they're simply part of aging. Early evaluation can often prevent more serious complications and help preserve bladder and kidney health. If you found this information helpful, let me know in the comments whether you've experienced frequent nighttime urination, a weak stream, or the feeling that your bladder never completely empties. Your experience may help someone else realize they're not alone. Don't forget to like this video, subscribe for more science-based health advice, and share it with a friend or family member who deserves to protect their bladder health before small warning signs become much bigger problems. Many people believe that straining is the fastest way to empty the bladder. It feels logical. If urine isn't coming out easily, simply push harder. Unfortunately, that's often the opposite of what your bladder needs. Excessive straining increases pressure inside your abdomen, but it can also cause the pelvic floor muscles to tighten instead of relax. When those muscles stay tense, the bladder cannot empty as efficiently, creating a frustrating cycle that repeats every day. Instead of forcing the urine out, try allowing your breathing to do the work. Slow, steady breathing helps reduce unnecessary muscle tension throughout the pelvis. As your body relaxes, the bladder muscle can contract more naturally. Many patients are amazed that relaxing actually works better than pushing. It may feel unfamiliar at first, but this gentle technique supports the body's normal urinary reflex rather than disrupting it. Now let's discuss the third scientifically supported step, and this one is overlooked surprisingly often. Your sitting position can influence how well your bladder empties. If you're sitting on the toilet, place both feet firmly on the floor or on a small footstool if needed. Lean your upper body slightly forward while keeping your back relaxed. Rest your forearms gently on your thighs and avoid holding your breath. This position helps reduce unnecessary tension around the pelvic floor and may allow urine to flow more freely. Small adjustments like these have been studied in urology and rehabilitation research, particularly among older adults experiencing urinary symptoms. Another habit that quietly makes bladder problems worse is reducing water intake because you're afraid of frequent trips to the bathroom. While this seems reasonable, concentrated urine can irritate the bladder lining, making urgency and discomfort even worse. Proper hydration throughout the day supports healthier bladder function, although it's often helpful to reduce large amounts of fluid close to bedtime if advised by your healthcare provider. Finding the right balance is much healthier than avoiding water altogether. It's also important to understand that incomplete bladder emptying isn't always caused by aging alone. In men, an enlarged prostate is one of the most common reasons. In women, weakened pelvic floor muscles or pelvic organ prolapse may contribute. Diabetes can damage the nerves that control bladder function. Certain medications, including some antihistamines, antidepressants, and pain medications, may also interfere with bladder emptying. That's why persistent symptoms should always be discussed with your healthcare provider instead of being accepted as normal. Pay close attention to warning signs that require immediate medical care. If you suddenly cannot urinate at all, develop severe lower abdominal pain, notice blood in your urine, experience fever with urinary symptoms, or have repeated urinary tract infections, seek medical attention without delay. These symptoms may indicate a serious condition requiring prompt treatment. Ignoring them could increase the risk of bladder damage or kidney complications. The encouraging news is that many people experience meaningful improvement by combining healthy bathroom habits, appropriate hydration, regular physical activity, and early medical evaluation when needed. Small daily changes often produce better long-term results than waiting for symptoms to become severe. Your bladder has served you faithfully for decades, and with the right care, it can continue to support your independence for many years to come. I'd love to hear from you. Have you noticed frequent nighttime urination, a weak urine stream, urgency, or the feeling that your bladder never completely empties? Share your experience in the comments because your story could encourage someone else to seek help before serious complications develop. If you found this video valuable, please like, subscribe, and turn on notifications. Every week, I share evidence-based health advice designed to help adults over 60 stay healthier, stronger, and more independent. Thank you for watching, and I'll see you in the next video.